But first, let's take a further look at the face masks. We're going to have a look at enforcement shortly. But first, let's get the science. Senior clinical lecturer at the University of Exeter Medical School, Dr. Bharat Pankhania, is with us now. Dr. Pankhania, welcome back to the show.
Good afternoon. Thank you for inviting me.
We're always pleased to speak to you. And actually, on and off in our on-air encounters, we've spoken about masks. First of all, can you tell us about the benefits of wearing a face mask?
So the benefit is not absolute. And we are where we are with respect to lifting off the lockdown and now starting economic activity again. So the idea is that you reduce the number of infectious droplets coming out from somebody's nose and mouth. So, and the other thing is the evidence. The evidence tells us that we cannot say, you infected people don't do this, that, and the other, don't come to work, because we don't know who the infectious people are. That is crucial. 80% of people are infectious without knowing that they have the disease. So the only way to protect and mitigate against, meeting up and going back to work, that sort of thing, is you try and reduce the number of infected droplets coming from someone's mouth, and hence the mask.
But Dr. Pankhania, that may be very, very valid, but we are beating coronavirus in this country. The cases and also the deaths are dropping like a stone. Why introduce masks next week?
Very good question. Thank you. So look, the reason why the case numbers have gone down, and with the case numbers, the death numbers will also go down. The answer is very straightforward, and that is as a result of behavioral changes. What behavioral changes, you ask? Well, we have been in a lockdown. Once we start emerging from the lockdown and start mixing with other human beings, and we know that there is a background level of viral activity still continuing, and our borders are open, case numbers will go up. So it is not all over, not by far.
Why does it take Dr. Bharat Pankhania to explain this in a clear, cogent, precise way that the government has failed so spectacularly? Clearly, it's a policy you support. Do you regret that the government have explained this so badly?
I regret it very much. My job is I want to save lives. And since April, so look, I was one of the scientists who said, I don't know about the evidence on masks. But after thinking about it and considering it, from April onwards, I have said very clearly, we should be wearing masks in crowded places.
Indeed. What about pubs? Because at the moment, pubs escape this rule, Dr. Pankhania. Would you suggest masks everywhere indoors?
Well, this is the other ambivalence of the mixed, incorrect, or shall we say, not severe enough messages. So my message is very clear. Follow the science. If you are indoors, in a pub, in a noisy environment, everybody talking in a loud voice, and there's lots of people there, you will wear a mask. If you don't wear a mask, you risk getting infected. At the moment, because it's the summer months, my advice to people would be have your drink in the outdoors garden. Don't sit in a crowded pub.
Now, what is your feeling towards those who are against masks, who say it is against their human rights, and also that the science is not consistent on this one?
Well, the science is not firm, but in the middle of a crisis, we cannot do what we call double-blind randomized control trial. That's gold standard. But it makes a lot of empirical sense, meaning, you go to the first principles of, does this make sense? Does it sound right?
Yeah.
And furthermore, seat belts, once upon a time, were an infringement on people's activities. Following the highway code, not smoking in public places, not smoking on trains. These were all cited as my infringement. We live in a society. We live for the many, not for the few.
Dr. Pankhania, we have looked enviously at the way that, for example, South Korea controlled the pandemic. I happen to think that given that obesity rates are very low in East Asia, that's clearly a factor, that the people are just more well and able to fight the condition. But of course, masks are a part of life in Asia and have been for many, many years. Our text poll of the day is as follows. Should we have face masks forever? Do you think once this coronavirus pandemic ends that face masks should be part of the way we live our lives in the UK?
I doubt that very much, that we live with masks forever. But I tell you what, our evidence indicates that the advent of increased hand washing and personal infection control has also resulted in fewer other infections. So we could learn a lot from wash your hands properly. And by the way, on the matter of South Korea, and we look at it so enviously, and I feel a lot of pain because the South Koreans did testing and contact tracing so well that they have so few deaths.
Indeed, they do. A great model for the rest of us. Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School. The very finest experts speak to Talk Radio.